Hey guys, it's Dave Man Max 6, and I have a groundbreaking new show for you guys today. I'm sitting in the doctor's office of my good friend Randall McClain. How are you, Rand?
I'm doing great. How you doing?
I'm great. So, very excited, you guys. A brand new show that I'm pitching to our good friends at Muscle Insiders, and it's going to be called Ask the Doc. This is the very first episode. I've known Dr. Rand for many years. He's a good friend, and Dr. Rand is actually a hormone replacement therapy doctor, owns his own clinic in Santa Monica, actually owns multiple clinics. So I wanted him to talk to us a little bit today and tell us a few of the facts versus fiction on all this stuff that is a hormone replacement therapy and, you know, growth hormone therapy and all that stuff. Dr. Rand, welcome to the show. Welcome to your show.
Thanks, sir. Well, I appreciate being on your show.
So tell me a little bit of background as far as you're an ex-bodybuilder. You have actually done bodybuilding for many years, just like us. So explain a little bit to me how you got started in this, why you decided to go into medical school to learn all this stuff, and then why you are doing what you're doing today.
Well, first, to set the record straight, I've never been a bodybuilder per se. I've never competed, but I've always appreciated the ability to develop the body. You know, every boy wants to look like Steve Reeves growing up, right?
Yeah.
Or, you know, Schwarzenegger, Cutler, whoever,
That's right.
depending on the generation. But I've always used it for athletics. So I've been involved with weights since I was 11 years old. And as we were joking earlier, whenever I go to the gym, it's like going to the office.
That's right. It's just like an office.
A lot of time in the gym. But I got involved in medicine because I got sick of trying to figure it out myself, quite honestly. Started with nutrition like we all do, and hey, how can we build the body? How can we improve our performance and that sort of thing? And then I went to Chinese medicine, which is great, but found myself a little hamstrung. I remember specifically being with a patient that had a kidney infection, which we probably could have cured with Chinese herbs, but would have been a little dicey, and thinking to myself, okay, this is not the way I want to go. It's an all or nothing deal for me. I want to be able to do everything that's possible, which would have included antibiotic treatment, preferably. And so I said, well, I'm going to go to medical school. And then once in medical school, it just kind of worked out. You know, with my past, being exposed to different things, you know, trying everything I could to become bigger, stronger, faster. I probably tended to pay attention more to what the teachers, the doctors, the professors were talking about when it came to endocrinology, physiology, and at that time differentiated a lot of what I call gym science from real science too, and that was interesting. And then just sort of stumbled into what I'm doing here, because my specialty is, like a lot of doctors that practice a specialty which doesn't exist, you know, rejuvenation medicine or anti-aging medicine. My specialty is really family practice.
Okay.
And anyway, came out, actually started working with another doctor who's a sports medicine doctor, and as I said, kind of fell into this because, you know, you attract the people that I guess are most likely to get some good advice from you, and this is where I had an area of expertise. So anyway, branched off into what I do now, which is sports and rejuvenative medicine.
Okay, so right now the questions are going to come from me today, that is. And if you think about something, please go ahead. But eventually what I want to do, you guys, is to make this show very interactive. And because it's called Ask the Doc, if you guys like this show, you'll be able to send me questions or Dr. Rand's question. We haven't figured out the whole logistic on the Facebook or how that's going to happen. We'll be able to use my personal email for now, but whatever. And Dr. Rand will be able to answer your questions on a, you know, bi-monthly basis, or once a month, or once a week. We haven't just figured out all the details yet, but basically he will be able to answer your questions, you know, on a regular basis. So tell me, Dr. Rand, what do you think are some of the biggest misconceptions about hormone replacement therapy today, and what people are the most confused about, or what would you...
Well, good question. Athletes or regular people, so to speak?
Regular people. Let's start with
regular people. Always confuse it with steroids.
Okay.
And that gets dicey because steroids, most people don't realize, are all the hormones that are made from cholesterol. But when we refer to steroids by saying steroids, most people think of anabolic steroids. So the biggest misconception I have to deal with from the start is remind people, look, we're replacing with testosterone, not an anabolic steroid.
I see. Gotcha. Okay. So as far as bodybuilders then?
Bodybuilders, it's usually, and I use the term loosely, guys that are coming in who want to be more athletic, want to be better bodybuilders, and you'll understand my differentiation in a second, because guys that are at the top of their game realize that what most young guys come in with a misconception of is it's not just about steroids or testosterone or anything like that. You got to have the three basics of training right, eating right, and sleeping right in place, no matter what you do. So that's the biggest thing I have to start people with who are new to this and say, whoa, wait a second. A 40-year-old guy coming in for replacement therapy thinks that, oh, now I'm going to have a buff bod just because I'm starting replacement therapy.
Yeah.
And I have to remind him, no, there's plenty of fat ass 20-year-olds, that have plenty of hormones flowing but don't do the work to get in shape.
That's true. That's very true, actually. Okay, Doc. I want to go back on that question, and this is more for the general public, how your work is viewed or how they see steroids in general. There's a really negative connotation to the name or to the word or to what you do, and some people think, oh, it's bad, or it's not healthy, or it's a negative thing. Talk about that a little bit.
Well, that's an interesting one, and I'm not really sure how it got its bad name, so to speak, so that now if you hear the ads on TV, they refer to low T as opposed to mentioning the word testosterone.
Right.
I suspect it was a political thing, just like, and I don't mean to cross, topics here, but medical marijuana. Without the psychoactive components, there's research showing that some of the ingredients in hemp or cannabis are actually really good for you. Same thing with testosterone. It was used back in, well, first of all, it was discovered in 1935. It was used, and we have record of this, by the way, back in the 50s and 60s for things like depression in females. And so it was used ubiquitously, like a lot of the other steroids, not anabolic steroids, but estrogen and progesterone is used for females regularly. But then it lost favor for, again, I don't know why, but it became a bad name, so to speak. Officially in '76, it was banned from the Olympics.
Right.
So,
but the media is really harping on that all the time.
Well, recently we have another problem in that they published at least really two studies, one of which I can give you the short scoop on quickly.
Mm-hmm.
It was really irresponsibly published, and a lot of people believe that. Not guys like me, but guys from academics, Harvard, Columbia, Yale, sending. They all sent letters to. This is on my website too, if you want to check it out.
What is the website? I don't have
a fancy website. It's just an old nerdy science website. But
what's the website?
PSRMED.com.
Okay.
That wasn't meant to be a plug, by the way.
That's okay.
Because it's certainly not anything to show off. Except it does have the articles. Pulled from the internet to explain it, because I have to explain this on a daily basis, because lately you see every 15 minutes an ad on ESPN for low T, and then you see an ad from some law firm involving a class action lawsuit against Pfizer, the companies that make the gels and creams.
Yes.
You don't see them suing doctors, and you see them suing the big companies because it's a class action lawsuit, which is the brass ring if you're an attorney, because it's big money.
Right.
And it's all about money. My best friend in the whole world is a PI attorney, and I called him up, ranting about what was going on TV and how illegitimate it is, because the facts support use of testosterone, not these things that are claimed, heart disease. What the studies show, in short, is that, first of all, they used veterans, the Veterans Administration hospitals, they used veterans. The numbers that they used to determine low T were extremely low to begin with. So these guys already had really, really low T. And then the treatment levels brought them up to low T, just a higher level of low T. So the facts, and there's more to it than that, but the facts are very misleading. There was no assurance of compliance, the use of the gels and patches, and there's a reason why you have to use those every day, because you're going up and down, and that's a whole other topic about clinical efficacy. But the question originally was, why is there such a misconception?
And why is it such?
It's really more of the illegality of it. They schedule it as a controlled substance, Schedule 3. You have to have a prescription, obviously. And then the media has given it sort of like the movie, and I've never seen it, but I've heard about it. Reefer Madness has given testosterone a bad name, saying that you're going to do everything from get liver cancer, to lose potency, fertility, etc.
Mm-hmm. Yeah, it's too bad. So you're taking not only your job very seriously as far as educating people. I mean, I like that about you. When people come to see you, you don't just prescribe something to them that day and tell them take this 3 times a day. You actually go out of your way to really educate the people that come and see you, and I like that. I think that's great.
Well, I'm a registered libertarian, I tell a lot of people. So my job is to educate you, and you make the choice. As long as it's within the law, I can prescribe a method to rejuvenate you, if you will, however you choose. And the best way for me to allow you to make that decision, so to speak, is by educating you as best I can. And oftentimes to a fault, as you see by the way I can ramble on here about any topic. But no, I feel like it's my responsibility to educate as much as possible, and then you make the decision as to what works best for you.
I love that. I think that's great, and this is what this show's about, you guys. So, like I said, sometimes you tell me all the good stuff off camera, so we gotta stop doing that.
Well, we can do it again.
All right, Doc. So, tell me why it's actually good for you to be on hormone replacement therapy past a certain age, and why testosterone is good for you.
Well, that's an easy one. We've got studies that show that there's an association, a correlation between low testosterone and things like coronary artery disease, type 2 diabetes, colon cancer, prostate cancer, osteoporosis, to name just 5. And we have studies that go back as early as the 1950s, 1960s that show this and continue to show this. And as I was saying off camera, and I should have said it on camera, mm-hmm. For every one study, like the one I referred to earlier, there are tens of thousands of studies which show the benefits to restoring youthful levels of testosterone.
So do you think that people sometimes, and I'm talking more of the general population, are reluctant to use testosterone because they just don't know much about it, and they're basically just believing those studies, those lawsuits on television or the media, or media demonizing steroids in the sports, and that's why they're like seeing this as a bad thing?
Well, again, I don't know. I can't speak to originally what happened, but when I talk to people when they come into my office, mm-hmm. I always see a general fearfulness.
Right.
Actually, by the time they get to my office, they're not as fearful because they pulled the trigger to get here.
Right.
But yeah, speaking about it with people in the gym and around town, there's a reticence to come in, and it could be from any number of reasons. They still have in package inserts for testosterone a warning for liver cancer. Where'd that come from? That came from back in, and I may get the dates wrong, but back in the 50s, I think, when we were using methylated testosterone for treatment, oral methyl test. Oh. Well, yeah, the reason why it was efficacious is because the methylation slows the breakdown in the liver, but that makes it hard on the liver. So there were some rare cases to which they attributed the use of methyl testosterone to liver cancer after 20 years of use, and so they throw that on there for the legal protection, I guess.
It's very misleading.
We still keep it on. Yeah, very misleading for that reason. Yeah. And that's just one example.
I see. We'll talk about the money. You're talking about those lawsuits, and just that was very interesting what you said.
Well, that scares people. I mean, I have people that are on therapy successfully for 5 years that come to me, or either after they've come off of, they just stopped without even talking to me about it, or come in and talk to me just about those lawsuits. And again, to your earlier question, I think that's what scares people a lot too. Just mm-hmm. the media stuff that's out there, mm-hmm. Not just the package inserts. That was all about money. I started to talk about it earlier, but mm-hmm. I when this came up and I was getting inundated with patient phone calls, I called my friend who's an attorney, my best buddy, he's a PI attorney, and I said, "What's going on?" And he stopped me in my rant and said, "Rand, it's all about money. This is a class action lawsuit. They're going for the brass ring on this one. They're not suing doctors. They're suing the deep pockets." You have to remember that the duty of the board of directors is to save or make the company as much money as possible. So the decision isn't made based on what's
right.
Right, what's medically correct. It's what's best for the company, to pay off the attorneys in this lawsuit or to defend ourselves. It has nothing to do with the right medicine.
Right.
And I think that makes it very confusing too, because people say, well, how come they still have these commercials on there if they've already, the Harvard, Yale professors have already written and said, you need to retract this article. How come it still goes on? Well, it's based on money. And I don't mean that cynically. It's just that's the way it is.
All right, understood. Okay, so let's talk about your profession for a second. Why is it so hard to find two doctors that are on the same page and are telling me the same information you're giving me right now?
Well, it's twofold.
Okay.
As we were laughing about before the camera rolled, you've got a lack of education in medical school. This isn't taught in medical school. We might spend at most an hour, really at most an hour, talking about these hormones.
Really?
To any large degree. Secondly, doctors tend to, and I don't mean to sound unprofessional or like I'm bagging on anybody in general, but we all know there's good and bad in every profession.
Mm-hmm.
But a lot of doctors think that once they get their degree, well, we're done, and we'll just start treating patients now, instead of keeping up with the latest studies and information that we have available to us now, particularly on the internet and all kinds of ways we can learn about this stuff. The problem with that argument is this, these studies have been around since the 1950s, but that goes back to the mentality of, hey, everything I learned or need to learn, I learned in medical school, which is wrong. I think that's it in a nutshell.
So you think that the doctors that are going to be against possibly, hormone replacement therapy, they stopped learning. They basically have not, what they've learned in medical school, and that's it. That's the extent of it. So that's part of the problem.
That's what I find, and again, this is through patients. Some of it's in discussion with my peers, but I had a patient in just yesterday who was getting therapy, testosterone therapy, from his urologist.
Okay. Was
not getting anastrozole therapy, anything to block the conversion into estrogen, which was remarkable, since we know that we've identified at least a half a dozen genes which all men carry that cause prostate cancer, and we know that they're activated by estrogen. So here's a urologist that doesn't cover the estrogen, so to speak. But the urologist, and this is per the patient, of course, came to the patient and said, I'm not going to inject you weekly anymore because of the studies that were being placed on ESPN, the ones to which we're referring, the class action lawsuits, and said, I don't feel comfortable giving it to you anymore, and that was that.
Oh, boy.
So, yeah, I mean, there's a lot of ignorance with doctors, ignorance in general across the population. No excuse for doctors, because we're supposed to know better.
Right.
And particularly a urologist, you would think, or an endocrinologist. The problem is, again, just to drive home the point, endocrinologists are trained. We're all trained in hospital and small office settings, where the demographic is usually different, because quite frankly, the wealthy don't want a resident to be working on them. Okay, they're not going to go to a family medicine clinic. Well, who are the people that go to family medicine clinics? They're people that oftentimes are working 3 jobs, and they don't care about their low testosterone because they don't want to have a 6th kid, right? They just want their shoulder fixed so they can get back to one of the 3 jobs. So we don't learn a lot about it because we don't see a lot about low testosterone in family clinics. Hospitals, same thing. You don't see people being rushed to the ER with low testosterone. Okay, the endocrine problems we see are diabetic ketoacidosis or thyroid storm. Those are emergencies. So we don't get the hospital exposure either.
So it's more of a specialty.
Yeah, well, it is a specialty. Endocrinology covers hormones, but again, our training in endocrinology, we don't see patients with low testosterone.
Yeah.
So it kind of goes, whatever little we learn goes in one ear and out the other, because we don't use it.
But it becomes a huge problem in normal society because everybody gets older after a while.
You're right, and everyone is like getting reading glasses. Eventually, most of us are going to need them.
That's
and
right.
So, yeah, you alluded to it earlier. My job is to educate, both for personal gain, because that's how I make my living,
right,
but also because, again, everybody needs it eventually. And I say that, I'll get slammed left and right, but who cares? Everybody needs it. That's a matter of opinion, too, because that's the other problem, is a lot of medicine says that we don't need really anything unless you're outside of the natural range. Or the normal range. And my quick answer to that is it's natural and normal to get sick and die one day. So natural and normal isn't all it's cracked up to be. So that's a point of contention right there.
What is a normal range? Why don't you tell me, what is a normal range considered in medicine for testosterone in a man?
Well, normal, again, let me just restate, who cares?
I know.
But depends on what lab you use. LabCorp is somewhere around 350 to 1150.
Okay.
And what we generally agree upon, Abraham Morgenthaler wrote a book, Testosterone for Life. He's associated with Harvard, and he's a urologist. He throws out 450 nanograms per milliliter of testosterone as being anything less than that is considered cause to look further into whether or not you're hypogonadal or have low testosterone. And that's the other thing. You don't treat numbers, you treat people. Okay?
Right.
You got to have the symptoms.
Right.
And that's first and foremost. Somebody might have been their whole life running with high testosterone, let's say. And for them, 600 feels low. So do you treat them or not? I mean, this is where, you know, we're still working these things out in terms of standard of care. But, you know, it's obvious if someone doesn't feel right, you treat them. And in reverse, too. If someone comes in with 425 below the 450 level, but they feel great, why would you treat them necessarily?
That's right. So it's a case-by-case basis.
Right.
Very good.
Okay, last question for today, Doc. I'm not gonna keep you long. I could talk to you all day, but
well, obviously I could keep spewing all day too.
Why is it? And you told us how you got into the business, how you got into medical school. Why is it important for you to do this work? Why? And you seem to like it so much as well. So why is it? And this video as well. When I talked to you about this video, you guys. He was on board right away. I didn't have to sell him the idea too long. He says, "Man, you know me. I'm a talker. Let's do it." You know. So why do you want to do this? Why is it important for you to do what you're doing?
Well, what a great way to go through life when my job really isn't work. I mean, that's the easy answer. That's the short version.
Right.
And you know, I don't want to sound corny or anything, but you know, I love what I do. Think about the patients I see. If anyone out there has experienced or is experiencing the feelings of low testosterone, it takes the wind out of your sails.
Yeah.
And then they come in, and after roughly 6 weeks of treatment, they come in, you know, with a smiling face. You know, marriages, and again, I don't want to overplay it, but it is true. Marriages have been reconciled through this.
That's awesome.
You know, jobs have been salvaged because people have the libido, the energy, the sense of well-being, the joie de vivre to live life again. I'll tell you one that'll kind of cinch it. I had an older guy came in with his son. And this guy at the time was 77 years old.
Oh, wow.
And he got up in the morning, didn't leave the house until 4:30. He'd go out for a little walk, mainly because his son encouraged him to, or chastised him to, or whatever. Came back by 5:30 for the evening news so he could get good and depressed, and was here, didn't say it out loud, but you got the feeling that the only reason why he was still around is he didn't have the courage to off himself.
Oh, man.
I call it courage, but that's another topic.
Right.
And to get to the meat of it, after 3 months of therapy, he came back for a 90-day follow-up, okay? And he's throwing tight spirals in the street with the kids and asking me, because he was here reluctantly, because his son brought him earlier, what else can I do for my health? I mean, you know, how is that not going to put a smile on your face and make you feel good about what you do for a living? So that's it for me. I mean, that's easy question to answer.
That's great. You said it takes about after 6 weeks of therapy, and this is like an off tangent question. How long does it take for someone to actually start feeling better when they come and see you?
6 weeks, and we don't know why that happens. I could bore you with my guesses as to why, but a lot of medicines work that way. This is a hormone, obviously, but you know what?
I thought it was faster than that. 6 weeks, huh?
Well, everyone's different.
Right.
I'd rather under-promise and over-deliver.
Right.
But typically, it takes about 6 weeks for it to kick in. Other drugs like SSRIs, antidepressants, are similar in nature. Sometimes I have people with really, really low T who say they start feeling it in 4 weeks, and I'll get the call, which I've asked for.
Yeah.
To give me updates, again, because I'm always getting good news. And, oh, yeah, Rand, I just want you to know, I'm different. I'm sleeping better, and I have more energy, and those two kind of go hand in hand.
Yeah.
But also, well, then I get the call about 6 weeks into it, and it's, oh, now I know what you're talking about. And I'm waking up with wood. I'm going to the gym. Throw another 45 on each side. Now, obviously, I'm talking about the males out there.
Yeah.
But women, it works the same way. And maybe this is educational too. Every male and female, we share the same hormones, just different ratios. Okay, so the same effects. I mean, we're talking to bodybuilders in general. There are female bodybuilders here too, right?
Right.
Or I should say, really athletes. But it goes without saying, this is for men and women, and just the analogy about the waking up with wood obviously doesn't apply. But no, I mean, to answer the question, 6 weeks comes up, and that's generally when it kind of hits you over the head, and you feel considerably better.
That's awesome.
Yeah.
today was a great day. I'm very glad we started this. Thank you for doing this show. I think it's going to be a hit. I think people are going to be getting really excited to be able to send their questions. And then I want to thank you very much, and I can't wait to see you again.
Well, thank you very much.
Thanks, man.
Goes Venice, guys.
We're going to meet up with Dr. Rand. Dr. Rand, how are you, my friend?
Good. How you doing?
This is your second office.
It is. I tell my wife I'm going to do morning rounds.
This is where you spend most of your time. Hide.
Thank
How
you.
are you, my friend? We know these guys. How are you guys?
Best doctor.
Is he the best doctor?
The best doctor, yeah.
We're making the rest of the world finding that out right now. You like this guy? You need the best? He's awesome.
We love him.
Thanks,
All
man.
right, thanks you guys.
Supporting bodybuilding always.
All right, you see that? That was great.
Good guys.
All right, let's get in there.
Thanks.
See what's going on.
In and out.
Hey, I like the shorts. I don't know about that shirt though.
You gotta represent, man. I gotta be truthful.
That's a favorite bodybuilder cheap food though. I gotta give you that. They love it, right?
Triple or whatever they call it.
That's right. Yeah. Like you don't know. All right, what are we doing today? A couple of sets?
Yeah, whatever you
You're
think.
gonna go see Jeff? Jeff Metcalf, great guy, also right next door at 12
Yeah,
o'clock.
no, I don't want to get too stinky. I'm just doing this for the
Just for the camera.
the camera.
All right.
So. Buenos días.
Nice. Everyone knows you in here, man. You come in, you're like the mayor of Gold's Gym.
I'm blessed, definitely.
How did that make you feel? And I swear to you guys, this was unscripted as we just come in here, Gold's Gym. Pedro Barron and Hide Yamaguchi's like, this is the best doctor. How does that make you feel when people say that?
Well, like I say, I love coming here. I don't want to sound corny, but I love my job, and I figured that easily I spent more time in the gym than anywhere else in my life.
Right.
You know, since I'm yay high.
11 years
So it's
old,
like-
that's young. I didn't know you started that early.
Well, we didn't have. That was out in the grass with remember the old sand weights?
Yeah, the Weeder ones, yeah.
We had our first Nautilus gym in the Grove, the Coconut Grove, probably when I was 15.
Wow.
So, okay, from 15 to 52, been in the gym most of my life. So, yeah, I love it here.
Yeah, man.
That's all I'm at that, you know? How can you complain?
Very cool.
Can't have a bad workout here.
That's right, that's right. It's embedded. You look good,
I
Doc.
feel those for a week after never doing them.
You look good, Doc. Thanks for today, man. We're going to see you soon, okay?
No, thank you.